telehealth is like an ER, like you go into the ER or urgent care where you just maybe seeing a doctor one off, even though we offer a primary care service where we treat chronic conditions like diabetes, cholesterol. We still encourage patients to see a doctor in person at least once or twice a year, because I do understand the importance of that in-person visit. Again, when you really do need care, that's when telehealth comes in.
Are you curious about discovering ways of making your life better? Then welcome to my podcast. I'm Bob Nickman, and this is The Exploding Human. Listen in while I talk with all kinds of people in the fields of personal growth, health and healing, alternative therapies, psychology, spirituality, environment, and the future. I'm looking for those answers that make life better for everyone. You'll meet cutting-edge practitioners, doctors, artists, filmmakers, business people, and those who have overcome challenges. The brave, the curious, anyone who's out there helping us humans to explore, expand, and explode. Hey, welcome to The Exploding Human. My name is Bob Nickman. My guest today is TJ Oshun, and we're going to be talking all things telemedicine and digital medicine and the future of technology in helping people get healthcare from the convenience of their home. TJ has been involved in telemedicine with his company callondoc.com since before the COVID epidemic. So his platform was already in place when the pandemic hit, and he was able to help a lot of people that way. So we are going to be talking about the many advantages of telemedicine, including easy access and convenience, low cost, privacy, and a much wider range of services than I actually thought was possible. So let's jump into it. Here he is. This is TJ Oshun. Welcome to the show, TJ. I'm so glad you're here. Folks, he is in traffic. He's been sidetracked by a protest near the United Nations. We don't even know what's being protested. At least I don't. It doesn't matter. So he's in his car, but it sounds really good. So I'm happy you're here. We're going to talk telemedicine, something I've done, but I don't know that much about it. How did you wind up becoming an expert in this field? I know that you know a lot and you've been around.
Yeah, thanks for having me, and I'm glad to. I'm glad I was able to join. Hectic day.
Yeah,
I was going home and got pulled over to the side by the cops. Like, hey, you can't go here. So I live close to the UN, but I'm happy to be to be able to join your audience and share my thoughts about the industry. So I've been in telemedicine, I'll say, since 2015. This is way before COVID, when no one knew anything about telemedicine. It was I stumbled into telemedicine because I wanted to provide care for my patient. So the journey started as as a medical provider at a local clinic in Dallas, Texas. So I partnered with my colleague. We launched a medical clinic in Dallas, Texas, and the clinic was successful. But we soon find out, as most clinics, that the no-show was tremendously high, and I had to do something about it. The entrepreneurial spirit in me, jumped in and was like, what do I need to do? I did a bit of survey and realized the reason why patients didn't show up for the appointment was because of the inconvenience and of either childcare, leaving their work. As you know, most clinics open 9 to 5 when most people are at work. And I decided that, what if I brought the care to them? I decided to go to their home initially, and I'm like, no, that would be very hard to scale, traveling to folks' home. So I decided to do more of a virtual approach via phone call. The patient was happy. However, I wasn't clear about the technicality and state license approval for it. I called the Texas Medical Board at that time, and they were like, I don't know what that means. Phone consultation, we've never heard it. However, if you can document that and establish a medical necessity, then you can get away with it, sort of. So what we did was we didn't accept insurance because we didn't want to get into the insurance billing process then, and it was just offered self-pay to the patient that needed the care that couldn't make it. So we had to establish medical necessity and document it. I remember at that time I told the representative I spoke with, I'm like, can you just send me an email that it was okay to speak with a patient virtually over the phone? So I got that email. So I still have that email in my inbox today as approved. This was way before COVID. So that's how we started, and expanding slowly outside of the clinic, outside of Texas, and then COVID hit. When COVID hit, we already had a fully functional website. At that time, it was only maybe 4 telemedicine companies, so we were maybe number 3 in the whole of United States. And COVID hit, so we had all the technology, the manpower, the processes, and we just started growing from there and scaling, and we were able to scale through all the 50 states and offered I think about 350,000 visits during COVID. So that's how we got here. Yeah.
Okay, now I've used, I was telling you before we started, I've used the telemedicine visits, whatever they call it. I guess maybe each company calls it something else, but, and I've had visits with my doctor, and for certain things,
Right.
There's certainly things I think you have to be in an office for certain things, like an annual physical. You've got to have those things, but what can you do now, and what can't you do in a televisit? It seems like it's expanding. I know there's prescriptions that can be handled that way. Here's something I thought of before we talked. What if you had, labs ordered, and the doctor could see your labs before you even had the visit, like for an annual physical? Like, order the labs, I go get them done. Now you've got my labs, and then we can have the visit over the phone.
So you mean if the doctor could have the labs before you even visited the patient, or
I know they can do it after, because I go to my doctor and they do the labs there. How is it working now? What's going on?
Sure. Absolutely. I think that's what threw me off, because it should be the other way around. The doctor should have the labs before you do. At least the way it works at my practice. And let me just sort of go back a little bit. We started as a telehealth company. However, we've expanded to more of a digital health company where we offer a wide range of services, and not just telehealth, right? It's not just visit. We do offer at-home kits. We built a lab in Texas where we actually process our labs and ship the kits to the patients. So that's one of the things that we offer. We also have specialists on our team, like dermatologists, that actually offer non-primary care. But we do understand the importance of in-person visit. Starting as an in-person provider as well, I do understand the importance of the actual face-to-face. So telemedicine is not here to sort of take away the value of in-person visit. Is more of a supplement to when those visits are not necessary. There's certain conditions like UTI that we call clinical diagnosis. You really don't need to see a doctor for that. Or if you had a positive STD test, do you really want to see a doctor in person for a positive test that you can do virtually and get started with treatment immediately? So there's certain things that we think are ideal for digital care. But going back to your question, the way labs work is obviously you establish medical necessity with a doctor. If in case of a physical examination, you order your lab results. The way we approach it at my clinic at Laser, in my practice, when the result comes back, the first person that gets the result is the doctor. So then the doctors sort of triage the lab result if it's an urgent matter that needs to be addressed immediately, or can wait until the next appointment date. So if it's something that needs to be addressed immediately, we contact the patient, right, and get it addressed, start the consultation and treatment, if applicable. However, if it can wait until the next appointment, we have a treatment plan in place, and the visit will just be a formality going over the result answering the patient's questions, and coming up with a treatment plan at that point. I hope that answered your questions in terms of the way labs are managed. I thought you meant the other way around, where you get the result before the patient, but technically the doctor should be having access to the results before the patients.
I was just talking about. No, I agree with that completely. I just think that I was just thinking, one way to do it. Like I go to the doctor, and for my annual physical, and then he orders the labs, and they're very standard. I'm talking about an annual physical. I'm not talking about a specific condition necessarily.
Got it.
And he orders the labs, and I get the blood work done right there. But wouldn't it be kind of efficient if you're going to do the sort of those standard annual physical labs, you just get them done first, so he's got all that information before he talks to you. But he's not going to be able to do. I guess you could have the lab do your blood pressure and look in your ears to see what those look like, and hit your knee with the hammer and all that crap. I mean, somebody who's not a physician could do that. I mean, it's a physician assistant level of care. I mean, the real sort of asset to a doctor is, the knowledge and the ability to ask the right questions if there's an issue.
Absolutely. And you're absolutely right. Some states allow patients to order their labs. We do offer labs online where you can actually order the basic lab, and we call it annual blood test, when you know exactly what you want. However, there's certain times when there may be medical necessity for certain labs that you may not need. For instance, if you're on a thyroid medication, you may think you need labs every 6 months. However, your last lab may require every 3 months, or certain medications with a high dose. So you still don't want to eliminate the input or the recommendation of your doctors.
Sure.
So you may not know that. Obviously, that's why you have a doctor. Saying most of the time is straightforward, but there's some nuances to that where you still need a medical guideline.
What can people do at home besides talk to the doctor in terms of, like you were saying, maybe mail something to the patient? What can be mailed to the patient that they can do? Is that possible? Or do you have to, or could there be a piece of it where instead of, I guess you could go to a lab, or you could have a nurse or somebody like that come to your home and do some of the basic things, so you're not taking up the physician's time as much as as it's been in the past.
Right, and all of those options are available. However, they may be expensive, having a nurse come to you.
Yeah, sure.
Or you traveling to a clinic to get it done. However, basic tests like CBC, which is just testing your blood count, CMP, that tests your kidney function, liver functions, you can actually do those things at home. Thyroid test, hemoglobin A1C for your diabetes, you can do those at home with a finger stick. You can also do STD test with a swab or urine test, and they're all reliable molecular tests that give you an accurate result that you can do at home. All we have to do is just ship the kits to you, and you follow the instructions, do finger sticks and send it back to us. And you get your result just as if it would be in a hospital setting or a clinic setting. Very reliable testing, a lot of studies, a lot of reliable machine equipment out there that provides this test.
Well, here's what I love about this more than anything. Well, like you were talking about the time efficiency, and people don't need to take off work. They don't have to drive. It's just incredibly efficient, and it's efficient on the doctor's time too. And I was telling you the example. I just had an annual physical, which I go in for once a year, and I have that. But and then he sent me a written sort of analysis of the test. But I had questions. I had some questions based on the labs and what we had talked about and some history. And so I booked a televisit with him afterwards because he doesn't have time. Doctors are very pushed to see patients for, less than 30 minutes. I mean, they're encouraged to do 15, which is not even possible in an annual physical. But, other visits, and I want to talk to him more. So I did do a televisit, and we talked. And it was after work for him. That's when he does them at the end of the day. And I happened to be the last one at the end of the day. So we talked for like 45 minutes, a lot of other stuff too. But it was,
Right.
I felt like this is great. Now I actually know this guy. He knows me. I have lots of questions. I'm a curious person when it comes to the human body, more so than
Right.
most. And so that was great. I loved that ability to do that. Otherwise, I wouldn't even be able to have that discussion. I wouldn't, it would be impossible.
That's the benefit of telehealth. Also, it offers you a wide range of options that you can personalize. And just to share a bit of nugget, we did a survey of about, I'll say, 500,000 patients internally, just asking the preferred method of telemedicine. And majority of them prefer chat. They do not want to get on the phone and did not want to get on the video call. And that's just maybe our patient demographic. Our patient demographic is just under 35. So
Yeah.
18 to 35, right? And even though we encourage the video visit all the time, but actually they do not want to, almost 75% of them just want to do a chat visit, right? And just get it over with. And right. So it does depend. So you don't want to, push too hard on those patients when you can actually have the same effective communication virtually. And it also depends on the condition as well. Certain
Yeah.
conditions you really want to have to spend time and explain with the patient to the patient. But if you have a condition that's straightforward, like a UTI or erectile dysfunction, or an STD that just needs antibiotics. So again, it depends. All right. So you're a patient that wants to be on the phone with your doctor, spend 30 minutes, 45 minutes with him, and you have patient B that just want a 5-minute call.
Well, your demographic being under 35, they're probably, obviously, their health is a little more vibrant than somebody who's my age. I mean, I'm in good shape,
Yes.
but I'm 70. They're half my age. So they don't have as many, dings. Let's put it that way. And they're like,
Absolutely.
although you've
Absolutely.
mentioned STDs a bunch, and I don't worry about that at all.
Yes.
It's not a
Absolutely.
thing for me.
Right, absolutely. Good pointing that out. And majority of our patients fall in that category, as you can imagine, the privacy of that, and also because it's discreet and straightforward and quick access to care. With STD, you cannot wait hours or days. Yes, it can worsen over time. So they want quick access
Yeah.
to treatment. So this is ideal for them. And I'm not sure if I mentioned, you can actually get prescription under 15 minutes with our service. So the moment you're exposed, and what we also do with telehealth is there's what we call PrEP, which is HIV PrEP, and DoxyPEP, which kind of prevents HIV from occurring if you take it within 48 hours. So if you're exposed to someone that has an HIV, or you were stuck with a needle, you really want to get on your medication immediately within 48 hours. If it happened on a Friday night, you're out of luck, right? You can get to a doctor. You have to end
Yeah.
up in the ER. Hopefully, they have access to care. So this is where telemedicine comes in, right? The quick access to medication, 15 minutes before your pharmacy closes, and you're protected from HIV. Same thing with DoxyPEP. Exposed to anyone with STD, you can take the medication, antibiotics, and you're protected from chlamydia, gonorrhea, syphilis.
Hearing those, I'm just so glad I'm an old guy that isn't playing around anymore. I know some people have a little bit of a reluctance because they wonder, at least I did, because I can see my regular physician with a televisit, but some of the things are, who is this doctor? I have never met them. What is their, are they good? It's everyone sort of worries about, what am I getting because it's so easy to do. Are these, physicians? I know they had to go to medical school to be a doctor,
Right.
so there's a certain quality that's sort of built in already. But just like any profession, some people are better at it than others. How do you deal with people that may be a little reluctant to participate?
I totally understand the apprehension. My recommendation is, if you have a doctor, I say stick to your doctor that knows your health. However, telemedicine is not, again, replacement, for your
Yeah.
doctor. It's when you actually do need immediate care, or can have access to immediate care or can't afford to see a doctor, that's when telemedicine really is important.
Yeah.
If you have a doctor, I'll say stick to it. Most of the doctor's offices offer telehealth now. So if you have a doctor and they offer telehealth, that would be your best option. They have your medical history, they know, then they have your labs, they know how to manage you better than anyone. Telehealth is like an ER, like you go into the ER or urgent care where you just maybe seeing a doctor one off. Even though we offer a primary care service where we treat chronic conditions like diabetes, cholesterol, we still encourage patients to see a doctor in person at least once or twice a year,
Yeah.
because I do understand the importance of that in-person visit. Again, when you really do need care, that's when telehealth comes in. The way you find a credible telehealth company is the longevity, how long they've been around, the reviews, of patients, and if you're apprehensive, you can just say, I want to talk to a doctor before I even, book an appointment.
Oh, okay.
Right. So you can start a soft conversation with, maybe a practice manager. And one of the things that we also offer on our platform is a refund. Um, if you don't like the visit, for whatever reason, we can reschedule for a doctor, or if you just want a refund and say, I want to go to my doctor because I don't have the right treatment that I thought I wanted, you will be refunded. So we understand the apprehension and the reservation that comes with telemedicine. And that's why we've been around for so long, because of that. If you have a visit that you don't like, or you still feel I need to go see a doctor in person, we refund you and you can go see a doctor in person, right? But most of the time, um, we participate in we let the patient participate in the care, right? The treatment plan, they understand the treatment plan before it's final. We just don't prescribe medications. We let the patient suggest medications that's worked for them in the past. As you can imagine, for an example, a strep throat, there are multiple antibiotics you can use for that. You have amoxicillin, azithromycin. Our doctor just don't just pick one. We ask the patient what medication has worked for you in the past.
Yeah.
And a patient A may prefer an amoxicillin because of cost or because of tolerance, and the second patient may just prefer azithromycin because of similar reasons. So those are the nuances that we've implemented to make it more comfortable for patients to try telehealth. And the most important part is, after our patients actually have used the service, it's kind of hard to tell them to go back to their doctor, because they understand the convenience of it and the personal touch that we add to the telehealth. So once you've tried it once, there's no going back, really. You always want to come back because of, again, the convenience
Oh, it's the
and
best.
the benefits of it. Yeah.
Okay, let me use strep for an example. I've got a terrible sore throat, which is usually where I know it can be in other parts of the body, but generally it's a terrible sore throat. I call, I have a visit. I go, my throat's killing me. It's been 5 days. I'm just picking something here. How do I get tested to see if I have it? Do I have to go? I do have to go somewhere to get tested, don't I? Or can that be done with a kit?
Sure, absolutely. So for certain conditions like strep throat, we don't have an official way to diagnose you virtually,
Yeah.
and obviously you have to do that in person to be able to have a confirmatory diagnosis. However, there's certain indicators that we use to reach the conclusion, to establish a need for treatment. For instance, the season, right? The season is one, and also you can take a picture of the back of your throat, where we can actually see the enlarged tonsils as
Yeah.
beefy red is a classic finding. And another indicator that we use to diagnose if a family member has been diagnosed, usually your kid has gone to their primary care doctor or the pediatrician like a couple of days ago, and now you have it, right?
Yeah.
So
Well,
that's
yeah,
another
that's a
right,
good one.
right, right, right. So we use those things to
Mm-hmm.
reach a conclusion and rule out other things, right? If you have other symptoms like a high fever, we suggest you to go see a doctor in person because of the fever may be too high. So we rule things in and rule certain conditions out to make a safe assumption, right? and we follow up with the patient like within 48 hours to make sure they're feeling better. And if they are, we know the medication is appropriate, and to just suggest to go see a doctor if they're not feeling better. Yeah.
Yeah, because I would worry about incorrect diagnosis being a little bit more frequent if the patient isn't there. But it sounds like you're very cautious.
Absolutely, absolutely. We one of the things that we're known for is our intake process, very lengthy, just to make sure we're not misdiagnosing. We ask a lot of questions of the patient. It could be frustrating, the number of questions we ask to make sure we're not treating correctly, right?
Yeah, you want that. You want to be annoyed,
right,
because
right, absolutely.
Yeah.
So we want to make sure your condition is actually at least stable enough, right? Where you have 48 hours for us to observe you. You're not in a critical end of the infection where you're having a high fever, you almost you're having short of breath and have all these end stage symptoms. So we want to make sure you have at least mild to steady symptoms to be appropriate for telemedicine.
Is it accessible 24 hours a day?
Absolutely. We are available 24 hours a day.
See, that's huge. That is a huge asset, because your doctor is not even close to that. And to be able to, you wake up at 2 a.m. and something's going on, and even if you're scared, even just, it's like, this is really strange. And, I don't want to have to go to the emergency room at 2 a.m. if it's not something that needs to be done. That would be a great thing.
Absolutely. And especially on weekends also, majority of the patients that we see on weekends are patients that actually saw their doctors on Friday that couldn't pick up their medication. The doctor maybe forgot to transmit the medication, but they have to take the medication over the weekend, right? Or the prescription never, successfully went through the pharmacy. Now they're stuck. But we come in and, fill the medications for them. They don't have to wait without medication for throughout the weekend. So those are the benefit of telemedicine, right? Again, not a replacement for your doctor, but to be a backup and supplement that.
I think it's probably economically very viable for people that may not be able to afford, especially if they don't have insurance. It's probably much more viable economically to be a part of what you're talking about.
And you're absolutely right about that. We charge $39.99, which I think is affordable for most people, especially relatively in the healthcare space. We actually one of the lowest telemedicine company, and it's been that way since 2017, since we started. One of the things I try to do is keep the costs at that price that's affordable, so we are well branded. And then I'll tell you a story behind that in a little bit. But also, most copays are around $30-$40 anyway. So even if you had insurance, right, you still end up paying a copay of maybe $20, maybe on the cheaper side. Mm-hmm. But then you may still get a bill from your doctor of $100 maybe. So you never know. So with us, it's flat fee, no insurance hassle, done. You have a follow-up visit, your prescription. You can still use your insurance if you have insurance at the pharmacy to cover the cost of the medication. Yeah. Or we send you an RS card. We have an RS card. We partner with a company that offers about 75% of prescription, where you can present to the pharmacy for discount on your medication. So we do that, right? But the good thing, one of the reasons why I want to keep that price at that $39.99 is we're making it very hard for other telehealth company to jack up their price, because they know that we're there. So everyone is $39 or lower. So we've actually stabilized the telehealth market at that $39.99. If we went up, then everyone will start increasing their price. A lot of companies are not profitable because of that. So we want to make sure everyone can actually afford telehealth, whether it's through our service or any other service. You will be getting that $39.99 range anywhere you go.
How many patients does your clinic, would you call it a clinic or a platform? What would you call it? How many people do you interact with a day?
We do see a lot of patients in the thousands.
A day?
a day. Yeah.
So you have multiple physicians, obviously. All
Absolutely.
Are they all around the country? Because you could really
Yes.
do this anywhere.
Yeah, all around the country, we have providers everywhere. We have nurse practitioners, physician assistant, medical doctors, nurses, pharmacy tech. So we do have a team, lab tech, a team that actually participate in the care of a patient to facilitate that. So even before you see a doctor, you have nurses that triage, that reviews your chart to make sure it's actually appropriate for telemedicine before you actually before the medical provider actually sees a case. So we have this system in place to facilitate the actual care of a patient, right? So we have a whole department with credentialing and licensing. So it's a full stack process and service.
Let's tell the folks the name of your company. I know there's multiple companies, but we're talking about yours right now.
Yes, absolutely. The name of the company is Call on Doc, like call, like you're calling on doctor.
Mm-hmm.
So Call on Doc, that's the name of the company. So you can go to callondoc.com and start your telehealth company or start your telehealth visit. Alternatively, if you don't need care now, you can just download the Call on Doc app. And so whenever you need help, care, whether it's weekend, holidays, we open on Christmas, Thanksgiving, and you need medical service at any time. We're open 24/7. As long as your pharmacy is open, we can send prescriptions there anytime. Download the app. Whenever you do a consultation through the app, there's additional $5 off the already low cost of $40. So you end up paying about $35 for that visit through the app. So I recommend using the app, and it's available anytime. In a prescription within 15 minutes.
Amazing that we're using technology in a positive way to reach a lot of people and make it affordable. That's really an amazing thing, a fine use of technology. Many things are not. This is like something that's really for everybody if they want it.
Absolutely. And there's tremendous opportunity down the line. We invest in heavily in technology. We have a team of software engineers that is trying to integrate AI to even make the process way better than what it is now. Who knows when the next COVID would hit? Hopefully not. But we want to have technology, be available to step in and provide care and reach many people as much as possible when we have such an epidemic, right? So this is what we're trying to do now in terms of using AI to provide care and reach more people in a much easier way.
So what are some of the most common calls about? I know STD is one of them because you've been mentioned it a few times. What else are you seeing a lot of or more of?
Conditions are seasonal. We're coming to the flu season now, so we're seeing a rise in respiratory symptoms, the strep, the sinus infection, the cold and flu. So that's what we're seeing a lot more now. Then that shift to other things like erectile dysfunction. So we also see a lot of those patients that just want erectile dysfunction treatment online because of the privacy of it. They don't want to talk to a doctor in person for those reasons. So we see a lot of those. But I would say it's a balance between STDs and respiratory conditions for the most part.
Let me ask you about mental health issues. How do you deal with that? Because I'm sure that's sometimes that's a factor in physical symptoms. Sometimes people are just calling because maybe they're depressed. Maybe they have incredible anxiety. How do you deal with that stuff? Do you have mental health people on your platform or referrals? How does that work?
We do not focus on mental health. So we do refer patients that need mental health services or counseling to a partner platform that we have, but we do not. What we do is the initial diagnosis. If patients wants to get evaluated to see if they have to see a doctor or not, we do the screening and recommend actual treatment with a specialist. Most of our doctors are in-house, are family doctors, so we don't pretend to be specialists in that area. So what we do again is screening and determine if patients actually need a therapist. What we can do though is if you have been diagnosed by a specialist and you are on a medication, we can refill the medication for you as maintenance, or if there's a need for a dose adjustment, we can do that. But for complicated, complex cases that actually need a specialist, we just refer you to our partner platform.
Now, are the physicians that work on your website and all that, do they have also office practices, or are they completely telemedicine?
Now they're completely telemedicine. They all came from private practices or hospital system. But then they cut the bug of telehealth, and that's all they want to do now. But yeah, most of the doctors are all full-time doctors. We don't have independent doctors per se, at least majority. And this is just to provide continuation of care for our patient and quality of care. So our doctors are actually dedicated to the platform, right? So full-time telehealth. They either left the private practice or hospital system for telehealth, and they see the advantage and value in telehealth and the future in it, and they see the good things that we're doing also. So one of the things I also did, I know I've been talking to about the patients and how we've actually improved the patient experience. One of the things I've also done was actually improve the provider's experience. Also, as a provider myself, I know all the pinpoint, the trouble charting and billing, all the pain points I was able to relieve, and the doctors now actually just spend time with patients and not necessarily the paperwork, right? So they love that about it. They don't have to worry about those things, and using technology to see patients with a button. You can write your note and just modify things here and there, and not spend all day after you leave your work, charting and documenting. So they love that about it.
That sounds amazing, and they can do it, live anywhere they want, which is an amazing advantage. I mean, if your doctor is in a happy situation personally in their personal life, they're going to be better doctors, my opinion. I mean,
absolutely, totally agree with you.
I mean, you could literally live anywhere because you're on the computer. That's what you're doing.
Yeah, absolutely. You're absolutely right about that. And they love it.
Yeah, I didn't even think until just now that they wouldn't have offices too, but they don't, because my doctor does both, but he's in a he's in a practice, so he's in a network.
Got it.
And he was saying, he was telling me, all these networks, they're really not run by doctors as much as they are MBAs. So it's going to get actually a little bit more difficult for patients to get enough time and attention in that situation, and there'll be less things that doctors are actually able to do, or because of AI is going to take it over. So this sounds actually, except for the having a person in the room with you, in many ways it's an actually more intimate experience,
especially with telemedicine. When you actually engage with the patient, is one-on-one, is focus on the condition you want to treat with that provider, and then you have the nurses also as a backup that can do a follow-up or provide additional health for you. It's not rushed so much because this is a provider physician led practice. They create their own protocol. They create their own practices also, and they all focus on sort of patient satisfaction.
Now, is there an insurance piece? Let's say I have health insurance, and I probably don't even need to use it for $40. It doesn't seem to even be necessary.
You're absolutely right, and that's where we came up with the $40, because that is about what your copay is anyway. On the cheaper side, you may have a copay of $10-$20, but who knows, if you build higher than that, you'll get a letter in the mail that you owe additional $70, $200. You never know. But with the $40, it's flat. There's no additional fee. Yeah. Again, the advantage is you can actually still use your insurance to pay for the medication or prescription sent to your pharmacy.
So there's no insurance piece on your side because you don't really need it. But if you have insurance, obviously for you got to go to the hospital or
Correct.
have procedures done that insurance needs to cover. That's not what you're doing. So
Right.
it seems like a great adjunct to people that actually have insurance if they want immediate care. I mean, there's a lot of times I've wanted to go see my doctor, and it's like, well, we don't have anything. There's no appointments.
Yes, absolutely. As you can imagine.
We'll see you in 10 days. It's like,
Yeah.
well, I'll be dead in 10 days. I'm not coming.
Yeah,
I'm
I know.
exaggerating.
And do you also understand it takes about 30 minutes, an hour sometimes to verify your insurance? And what we strive is to remove all that pain point. We don't want patients waiting to verify insurance, whether your network, we don't want that process at all. That's one of the reasons why we're not accepting insurance, because it does take a while to check eligibility and things like that. Let's get to the point, see your doctor, get your medication, and move on.
Yeah, I mean, if you're in a medical, having a medical issue, you just want to get it done as quickly as possible and figure out what's going on.
Correct.
And it sounds like that you're very diligent as far as go to the hospital, go see your doctor. This is above what we do. This is beyond what we can actually do for you. But then there's plenty of things where you go, oh, okay, well, let's send a prescription over to your local pharmacy and we'll get it taken care of.
This is one of the things that we're actually going to be using AI to optimize, where we only get to see patients that are appropriate for telehealth. So we're going to implement this sort of interactive AI, and we're already doing that now, but we're improving on that technology where we ask series of questions that may disqualify you from even making an appointment with a medical provider. If you're having chest pain, difficulty breathing, unable to move, unable to walk or move your arm, signs of stroke, our AI will recommend you to the right department or hospital system in your area. However, if you do qualify because you're stable and your symptoms are consistent with the condition, then you will be able to see a doctor at that point.
I just sort of scratched the surface with it myself, but it sounds like the ability to reach so many people is just a real thing. I guess the information that this exists is one of the roadblocks to having it be even more prevalent. I'm just, I'm doing a podcast on it and I'm just finding things out and I'm interested in this field. I think there's a lot of people, that are just regular folks, let's call them, that are out, and they don't know about it. That must be a little bit of an obstacle for you guys to get that information out there that it even exists, because it is fairly new it's in the last 5-6 years maybe.
Yes, absolutely. Very new, very new. And that, as you can imagine, you can have the most amazing product on earth. If you're not able to sell it or market it, nobody will know about it.
Yeah.
I met with my marketing team today, and we talked about how amazing our service is and just figured out how to sell it and offer the service. And that's why I'm able to come on your platform, and thank you for having me and being able to share the service. And this is what I'm going to be doing, going around the country, just telling them about the benefit of telehealth and how it is a life-changing technology that's affordable and here to say.
So folks, TJ Oshun, and it's spelled Oshun, which you could see on the description. The name of the website is callondoc.com. So call on your doctor, but don't call him a doctor. Call him a doc. Call on doc. See how I'm helping you out here? I
love that.
This is part of what we do here. We explain why things are cooler than most people would understand. So it's callondoc.com. TJ Oshun is the man behind that. He's got some partners, I think, right? You have some partners?
Correct.
Yeah. So it's a whole thing that goes on. So if you need some telemedicine, that's a place to go. And a lot of things can be done there. Thank you so much for being on the show, TJ. And thanks for calling in from your car. This actually worked out fine. This is the first one I've had from the car. First episode from the car. So That's
Perfect. Yeah, it felt just natural just being here. I totally forgot I'm in the car actually.
Oh, good.
Right. You don't even hear the New York sirens and noises behind us. So this actually worked out. And thank you so much for having me.
I heard no extraneous noise. There was one horn honk, I think, about 20 minutes ago, but who cares, right?
Right.
Makes it a little bit more authentic.
Absolutely.
He's in the car, and I hope you can get home soon. That's what I'm hoping for you.
Yeah, I should. I think it should be winding down now. So
thank you so much. I really appreciate your time.
Absolutely. Nice to meet you. This was fun.
Much appreciation for you folks listening to The Exploding Human. The website is theexplodinghuman.com. You can also listen on YouTube. That is The Exploding Human with Bob Nickman. Once again, I want to thank TJ Oshun for being on the show. And if you need more information, go to callondoc.com. Have a fantastic day. Thank you.